Welcome to Healthy Heart. This is Dr. Opoku-Asare again. Thank you very much for joining me today to continue our series on COVID-19 and cardiovascular disease. As I've said, that it's not just an issue of coronavirus, because we already know that there are 7 coronaviruses that are currently known to man, and this is the 7th one. It is important for us to know that unlike the other earlier coronaviruses that used to cause common flu, this COVID-19 and Middle Eastern respiratory disease associated coronavirus, as well as the SARS, are pretty distinct in terms of the severity of disease that they can cause. And that is why we all need to take certain measures to be able to help ourselves. So to go on to what is happening currently, as we talk now, we know that there are about 1.5 million cases. As at today, there are about 1.5 million cases around the world, and almost about 90,000 people, 90,000 deaths around the world, which is a huge number. And our hearts goes to all families all over the country and all over the world who have lost their loved ones as a result of this current pandemic. Within the United States, we know that about 440,000 patients have been infected. The United States is probably one of the countries that is doing very aggressive testing, and that is very important. And we have about 14,800 or near 15,000 patient deaths, which breaks the hearts of all of us, families all over the country. A young man in his 30s that I had opportunity to know for some time died actually 2 days ago from coronavirus. He was in his 30s, and he was admitted in another hospital in a state where they haven't got too many cases of coronavirus, but he's one of the few coronaviruses in that particular state, and he lost his life. There are also reasons for us to be grateful to be alive and for us to be grateful. Whereas in this country, there are about 14,000, as I said, we have about 440,000 cases that have been affected, with about almost 15,000 deaths. But the good news out of this darkness is that we have about 24,000 people who have recovered. The recovery is people who were sick that we thought that they were going to die, who recovered. And in this country, 24,000 people recovered. And we should be grateful to God for that. For the people, we need to also be grateful to God for the people who have also recovered, and also thank the government and thank all the healthcare people that are involved in taking these people that are recovered. Another good thing that is going out there, so that we all don't lose hope, because without hope we cannot move forward. Another thing that is happening is that, at least in the hotbed areas of this country, like New York and other areas, there's a trend. The number of patients that have been admitted for COVID-19 cases is lesser. It's getting lower and lower and lower. So hospitalizations in some of these hotbed areas is also coming down, and that is very, very good, because it's also another step forward. So I'm just enlisting some of the good things that are also happening, that in the midst of the numbers that are rising, these are good things that we can also look at. Hospitalizations for that is going down, and the other thing is that people are also, recoveries are higher than deaths, which is also a good thing. The other thing that we need to also be grateful for, especially for us that live in the United States, is the fact that compared to other countries, right, like Europe, I'm giving an example. If you consider the population of United States, right, or let's take New York, the population of New York and the population of California, right? The population of these two countries seems to be almost similar. These two states, I'm talking about states, it seems to be similar to the population of countries like Italy, right? And Italy has a 17,000 deaths. It's like almost just one state. Yet United States has a death of about 14,000. So the point that I'm making here is that it's what we are doing, the social distance and all the things that we're talking about. we should continue to do them. And then, because our mortality rate, the critical point is the mortality rate. Our mortality rate is still not as high as that of Europe. I mean, just consider one state. You can put like Italy or Spain to California and New York, right? Even if you put these two states together, just two states out of just two states will be like one of these countries. And yet our current in the case that we have now, it's almost only Italy itself has more cases than us in terms of deaths, and that is why we do not need to go back now, and we do not need to lose hope, but we should do all the things that are necessary to ensure that at the end of the day, it's very important that at the end of the day we will continue to see these positive trends that are beginning to happen. I'm saying these things because few people will tell you some of these things. Everybody will tell you that things are breaking down, hell is breaking loose, the world is coming to an end. That is the message they want you to get. But I want you to also understand that in the midst of this, there are certain good things that are beginning to happen. And my prayer is that these trends will continue, not only in the hotbed areas, but it will spread to the rest of the country. So these are things that we need to consider, and pray that during this holy week, if you've never prayed before, try to pray during this holy week, that these positive trends that I'm talking about, that the mortality rate of the United States will continue to stay low. The concept of mortality rate is how many people who get an infection will end up dying. So these are good things, and that is something that I want to stress. So coming to COVID-19 and the things that some of the things that have come up. So we talked about it's about a story that I heard recently, which was reported in which I looked at CDC. First of all, we looked at the CDC website, and we also looked at the story that came from Germany, which is very important here. Why is it important? Because now we know that if you look at the numbers that are there, that have been people that have tested positive, and the cause of it, right? Only 1,000 patients were known to have traveled. Number one. So, and only 9,000 of those people who had infections were known to have come in contact with somebody with what? With COVID-19. So out of the 400,000 cases, only 9,000 have a plausible way of tracing how the disease, the exposure, right? It's not, it's so if you look at it, that means that majority of them we don't know. And that is why it is critical and important that you and me, we take all the measures that we're talking about, because we really do not know how it's going on. But we believe that because of these trends that we've seen, we believe that some of the measures that are being put in place is working. But the truth is this, we still have not nailed down how this disease occurs. And that is why it is important that you take these measures. So let me tell you a story. I read a story today that was published in the England Journal, and it's important for you to know so that you will understand that all these measures are important. You see, there was a guy in January, he's a German guy, and his business partner came from China and to visit him in Munich. And not knowing that the Chinese partner, a female, did not have any symptoms, but she had contacted the coronavirus. And at the end of the day, whilst meeting this business partner, he transmitted it to him without he realizing it. She went back to China and then tested positive and reported. One way or the other, the people in Germany got to know. But the interesting thing is that the guy had fever, sore throat. I'm going to come to some of these things. Fever and a little bit of sore throat, and that went away. And it went away, and that is the time that they tested him, and he seems to have recovered nicely. But later on, three or four people in his office tested positive. And this is where it is interesting. Only one person out of the four who tested positive had contact with him. And reportedly, the person that had contact with him, he had contact with him when he did not have any symptoms. So it comes to support, that story comes to support what we are seeing from the data on the CDC website, that there is a mechanism of transmission that we are not aware of. And I believe that is why we should take measures to wash your hands. I very much believe that touching, one way or the other, the guy could have gone to a place and leave fingerprints there. So it is not a question of just coming into contact. Do the things that you need to do, wear your masks, but you cannot overemphasize washing your hands. So that is why you and me, we need to take the necessary measures to ensure that at the end of the day, we do not end up picking it from places that we do not want. This guy could have gone to any place where none of the members were there and they went back in, and that's what happened. So that is about the preventive part of it and the data where we are. So let us come to cardiovascular. As we said, what is happening here? So the data, there's some data that has come out, and I want to share that with you. 2 days ago, there was a publication in American College of Cardiology website, and I quote these things so that you can go there and read them yourselves, because this information is free. So once again, we now realize I'm going to discuss 3 main things here today for you to see what some of the things that we need to be careful about. So the 3 main cardiovascular conditions that we know is associated with worse outcomes if you get it. Hypertension is one. So people with hypertension, we don't know why that they end up with a severe disease. So let me backtrack a little bit. As we said, 81% of the patients will have nothing, or either nothing or what? Mild symptoms. So a lot of people may have contracted this and they don't know, and they will recover without anything. 14% are the people who will end up having symptoms, and the symptoms in these situations. So we're going to show you, we have pictures that you're going to see. On these pictures, you want to see the transmission of it, but a picture will show you how these symptoms exhibit themselves. Most of them are mild, and that is where it attacks. So 14% of the people are going to end up with moderate to severe manifestation of the disease. And we know now that 3 classes of cardiovascular disease, at least based on that paper, one is hypertension. So if you're hypertensive, be careful. Number 2, the biggest one that we saw is people with a blockage in the heart. That came to me as a blockage in the blood vessels that goes to the heart. That came to me as a big surprise. Actually, the odds, when we say the odds, the probability of they having severe disease or dying is almost 20 times. This is mind-blowing. 20 times compared to people who don't have blockages in their heart. So if you have got a stent in your heart, if a doctor has told you that there's a blockage in the blood vessels in your heart, please be exceedingly careful. I've told my patients who have that please be exceedingly careful in terms of exposing yourself to this condition. And the third one that we'll talk about is diabetes. So these are the ones I want to lay emphasis on: hypertension, diabetes, and you know what? Let me give you a perspective here. 100 million Americans have diabetes. 100 million Americans have hypertension. 100 million. So this is as common as it gets, and it is important that we keep ourselves and the whole lot of people. Just to put things in perspective, remember this: every 40 seconds, somebody in America gets a heart attack. It is important that if you have such a condition, we see this all the time. I've seen within the last few weeks, I've seen somebody as young as 35 years having a massive heart attack, and the heart dropping significantly, almost by the heart is supposed to be by 55, he was beating like 25%. This is what can happen. And if this person ends up getting a COVID-19, the outcomes based on what I saw in terms of ending up in ICU and other things is very serious. I want to give you a perspective here. You know, there's a whole lot of talk about many things, but I'll tell you, when it comes to COVID-19, prevention is better than cure. You know, because we are testing a lot of medications and a lot of things are here. Like many other conditions, particularly we know that when people come to us with shock, if the shock develops to a certain stage, sometimes no matter what we do as doctors, we cannot make a difference. And that's what we found. That in people that will end up on ventilators, the probability, once you end up on ventilator, the probability of dying is exceedingly high. And that is why we pray that even when people get sick, they shouldn't end up on ventilator. So it goes beyond. Sometimes when you get to that point, the ventilator may not make a difference, no matter how big our politicians would like that to look at. And the people who will end up on ventilators, most of them are the people that have got cardiovascular disease. I mean, this young man that I talked about that who died, he ended up on a ventilator. And when I looked at the data on patients who end up on a ventilator, I was very worried. And he ended up dying 2 days ago. Why? Because when the disease gets to certain severity, it is almost impossible for most of the things that currently that are available to us as physicians to be able to remedy, because it is not just a question of the virus, but what has happened is your own body beginning to react against each other. And we believe and trust God that as some of these will ultimately find a medicine or a vaccine or something like that to be able to stop this mechanism by which, you see, the coronavirus is what it does. Instead of attacking you yourself, it makes your own body attack itself. That is what we call the cytokine storm. So that part is a critical thing currently that we should be able to stop. So there are a lot of things that are going on that we need to. So I've talked about the 3 conditions. Let us go on to the other things here that we need to talk about, which is important. So it is known, I talked about it the last time, but I just want to lay emphasis on this one. It is known that when people come to us, 3 things that have been found in them, 3 areas that I want to lay emphasis on, is that sometimes it can lead to people having heart failure. We don't know the full mechanism of it. And that is why am I bringing it up? Most patients who have heart failure and other things, they are already on medications. I talked about it the last time. I'm going to lay emphasis on that because it's in the news all over the place now. Because people are on medications called ACE inhibitors, lisinopril and the losartan. Please do not, the recommendation is not to stop them, at least. And these are guidelines that have been issued. And it's very, very important. There is a very confusing data out here, but I will recommend that before you want to do that, you have a discussion. If you are on lisinopril, if you are on losartan, if you're on irbesartan, if you are on enalapril, these medications, it's important to have a discussion with your doctor. But the recommendation as we stand now is not to touch them. And my recommendation and anything that I will tell you is the fact that do not touch them and continue to take them in consultation with your doctor. That is a very important thing. But what I'm talking about is that people who may not even have heart failure, when they end up with COVID-19, may end up having those conditions. So it is something that is important for you to also notice. The other thing that we've also found in these patients is the fact that the enzymes for heart attack, I talked about it the last time, but to add a little bit to it, we now know that if you test positive for the enzyme for heart attack, then your outcomes are going to be what? Are going to be worse. And it's not clear to us why. Definitely, if you have a heart attack, we are still saying that is what I'm doing every day, that we will treat you the way it needs to be. And no wonder that people who have got a blockage in their hearts, as I said, the report shows that they are 20 times at risk of having either a severe disease or dying. And that is why you need to put in measures. So these things are there. And they are ongoing things now that we need to look at. The point here is this. I want to highlight a little bit about medications and I'll come back here. So remember, we've talked about prevention. Now we've talked about the disease manifestation and how we need to take care if you've got cardiovascular disease. Now let us talk about the medications here that we know. So some medications that are being tested now essentially include chloroquine or hydroxychloroquine. It is known that hydroxychloroquine, the data is still going on. The question is, at what stage will it be a benefit? That is what we don't know. Is it there is a data that was published with 62 patients that showed that it is working. There is other data that show that it doesn't work. But the reason why there is this confusion may be coming from the fact that the stage at which they're being tested, as I said, like other conditions, once you have got a very severe state of the condition, no medication may make a difference. We've seen that even in people with septic shock, in people with cardiogenic shock. Once you get to that stage, it may not make a difference. Probably it may make a difference with people with mild to moderate disease in terms of preventing them. And that is what the data that was published seems to show. But it's only 62% of the patients. It's important for you to know certain things about chloroquine in terms of the heart. That is what I'm here to do. So those of you that are taking that may be taking chloroquine, it's important that to know that there is something we call QT prolongation. That is something that is seen where it increases a particular interval. That is something that if you are taking it, it is important for your doctor to know, and then it is important for you to know. That is something that we know that it is associated with people taking overdose. So the fact that you heard that chloroquine works doesn't mean that. I know a lot of people have got chloroquine in their thing now, and the issue here is this: these cases of reported cardiac events come from overdose. Most of the time, we have extensive experience in the use of chloroquine based from Africa, and we know that the cardiac toxicity or the impact on the heart is not high. So there's something that we know. There is some data that long-term use of hydroxychloroquine can cause certain issues for the heart, but overall, I can say that overall mortality at appropriate doses of this medication should not be a problem. There is another medication that is being given to patients. It's Remdesivir. Remdesivir is a medication that is being used for Ebola patients, and is a medication that does not seem to have a lot of cardiac events, adverse events for patients. So that is good. The other one I want to talk about here is because people have had these medications and you need to be careful about it. That's why it needs to be given under direction of doctor. One medication that we use for HIV patients is also being used. That is lopinavir and ritonavir. These medications have been pretty effective in HIV patients. But it is important that if somebody is taking that medication, you need to be careful. There is a significant drug interaction between that medication and most of the medications that people take for their heart in terms of cholesterol medication. So and it can actually cause a 50% increase in your cholesterol. That is how this medication can do. So it is important that you are careful, because what is happening is that all of a sudden hydroxychloroquine is on back order 2 weeks or 3 weeks, and people who have connections with their people in Africa where chloroquine was abandoned, some of them have been able to get it here. Please be careful that you don't go about just taking them. I would strongly encourage that it should be taken under the directive of a doctor, and ideally it should be given in a situation where you've tested positive and you're having some symptoms. In that case, as I said, the cardiac toxicity of chloroquine is on the lower side unless you do overdose, and that of remdesivir is practically not known to cause that. But definitely the HIV medication, that is lopinavir and the ritonavir, are the ones that I'm concerned about, that you should be careful, because some of the medications that are very important for the management of patients seem to have a problem. So I just want to end by saying this. I'm bringing this session to an end for today, and thank you for joining me. The point here is this: our heartfelt condolences goes to all everybody that has listened to us, and all families all over the world who has lost friends, loved ones. As I told you of somebody that I came to know 30 years in his 30s who just lost his life to coronavirus. Very, 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 very heartbreaking condition. But we also have hope knowing this. More people who were probably supposed to die have recovered. 24,000 in the United States have recovered, and that is giving us hope. Hospitalizations in some of the hottest areas seems to also be coming down. My prayer is this, that at the end of the, first of all, may God bless all the doctors and all the people in this country. My prayer is this, my admonition to you is that continue to take all the measures, especially if you have a blockage in your heart, the blood vessels going to your heart, or if you have got hypertension or any cardiovascular conditions. And the last point is that my prayer is this. We are in the Holy Week, and for me, it's a time of prayer and fasting. My church is fasting throughout this period. We are fasting and praying for God's divine intervention, because we don't have a cure, we don't have a vaccine, we don't have a whole lot of things that we use to confront said epidemics. And my prayer is that these glimmers of hope that we've seen, may the good Lord continue to make them brighter, to drive away the darkness that is going on all over the world. Thank you very much for listening to me. God bless you. God bless America.